basically the most important diagnosis I've ever made for myself was that this was chronic stress. That's all it was. All those crazy things I just shared with you, the stress response in my body was making me feel these things, making me think these things. And once I learned how to work with all of that through physiology, with yoga therapy, meditation, and then life coaching through mindset work, that wonderful duo really was the answer to the chronic stress.
Welcome to the Licensed to Live show, where professionals, doctors, champions, VIPs, attorneys, and those in public office discover strategies that help you restart and gain what is lost when you find yourself accused. If another has doubted your integrity, questioned your credentials, or caused your actions to come under scrutiny, you are in the right place. On the other hand, if you have never felt the knot in the pit of your stomach when legal papers are served, the heartbreak of disappointing your family when the lock clicks shut on handcuffs, or had to appear before a board of review, then be aware, the longer you serve, the more likely you are to find yourself under the microscope of those who judge. Prepare yourself for this uncomfortable possibility. Now, here's your host, Dr. Jarrett Patton.
Welcome to this episode of License to Live. This is episode 91. I can't believe it. My name is Dr. Jarrett Patton, and I am your host together for our journey today and every day you choose to listen to this show. If you or anyone you know has been dissed in their career, please invite them to join us along this journey. Just go to Apple Podcasts, Google Podcasts, iHeartRadio, wherever you get your podcasts, and subscribe to License to Live. You guys know what I mean when I say dissed. It's like displaced, disgruntled, disenfranchised, dissatisfied. If you've been dissed, you are in the right place. Now today is a great day. We are going to be speaking with Dr. Robyn Tiger. She is a physician. She is a yoga instructor. She is a life coach. She does it all. And most of all, she is the StressFreeMD. And I can't wait to have her on to tell you everything she's up to right after we finish thanking our sponsors. Hey, this is Dr. Jarrett Patton. Do you need more positivity in your life? No matter what part of your life you want to transform, positive affirmations can help you achieve your goals. But sometimes making permanent changes can be difficult. Designed with you in mind, License to Live. Daily affirmations to rebuild your life will inspire and equip you to become the best version of yourself. License to Live. Daily affirmations to rebuild your life will set you on the path to changing your mindset, beliefs, speech, and ultimately your actions. You can change your life now by getting your copy at Amazon, Barnes & Noble, your finer book retails, or licensedtolive.com. That's licensedtolive.com.
Something smells good. EH3 coffee. EH3 coffee. Premium organic. Nothing better than waking up. EH3 in your cup. Premium organic. EH3 coffee. Nothing better than in the middle of your day. EH3 coffee. Premium organic. EH3 coffee.
This is Super Bowl champion Mike Logan, and you are listening to License to Live.
Welcome to License to Live, Dr. Robyn.
Thank you. Thank you so much for having me. I love your podcast. I'm so excited to be here.
We can't wait to have you here because I know that from time to time I get stressed. From time to time, the fire starters out there, they're getting stressed out. And you are the StressFree MD. So I can't wait to get some tips on how we can all make our lives much more stress-free coming from you. But let's talk about not only where you are today. I want to know where you began. Now, you're a radiologist by trade. Is that correct?
Yes.
Now, tell me, in all of the things that you've done, like I said, you're a certified yoga therapist, certified life coach, and you're a radiologist. So tell me, how did your life change to the fact that you went from practicing radiology to helping people reduce stress in their life?
Yeah, I'd love to. So, third grade. How early did we go back?
Let's go way back.
Way back. Woo, way back. So third grade, Mrs. Miller, if you're listening, she rolled out this life-size skeleton, and I realized that was not a Halloween costume, that's actually inside of our bodies. And that was amazing to me. So third grade, I said, I want to be a doctor. So then fast forward, I did the medical school, internship, residency, fellowship, and started practice. Boom, 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 boom. Somewhere in there, I got married, had some kids. And what happened though, Dr. Jarrett, over time is that I started to get sick. I started to have a lot of illnesses that I started seeking our medical colleagues for. So things like migraine headaches with intractable vomiting, that I never had a migraine in my life, vertigo, tinnitus that would keep me awake at night. My gums were bleeding. Weird. Gastroesophageal reflux, abdominal pain, poor digestion, pain in my body, especially my neck, my shoulders, my back. And I got these really weird symptoms in my hands and feet, paresthesias. For those of you who are not in the medical field, I would get this numbness that would just come out of nowhere in my hands and feet. And it would happen at really inopportune times. Like I'd be in a breast biopsy and my tech would say, "Hey, Dr. Tiger, you're right there. Pull the trigger." And I'm like, "Okay, I'm right there. I'm just looking at the lesion a little bit more." And the truth was, I couldn't feel my hand. And so there's a lot of physical stuff going on. Of course, there's exhaustion, lack of sleep, lack of focus and concentration. I was messing up things. I had us in the wrong airline to go to a vacation one time. We're supposed to be on US Air. I was on Air Jamaica. We went to see a show at the Academy. We're in talking Philly here. And I had us there at the wrong day. I was messing up my kids' backpacks. They had the wrong lunches. It was a mess. And
Wow.
I'll share with you that I had some really dark thoughts starting to pop up. Like thoughts I don't even know if I want to be here anymore. I'm actually telling you this, but I'm hearing this and it's unbelievable for me to actually say this out loud. And
Wow.
I saw docs, right? I saw GI docs. I saw gastroenterologists. I saw neurologists, periodontists. I had a therapist, and I wasn't getting better. And we didn't have the internet. It wasn't so much Googling, but I kept thinking, what kind of syndrome do I have? What do I have? I must have something really, really bad. No one can figure it out. I figured it out.
Wow. Wait a minute. So you had all of these symptoms.
All these things.
They were physical, bona fide symptoms from numbness in your fingers to digestive issues to migraines to all of these things. And you've been seeing doctors, you've been trying to take therapies and treatments. And then, what happens next? Tell me.
Yeah, what happens next is if God was on a bunch of pills, I was like, and I had, of course, I'm a radiologist. So I hopped in the magnet, I got imaging of my hips and my back, my neck, my shoulders, my big toe. You name it. I was imaged. Everything was negative. And I just said, we're kind of joking about it here, but it was serious. I was circling the drain. I really hit rock bottom. And I have an amazing husband, 2 great, incredible kids, had a job. Everything was on the outside. We looked perfect, the perfect family, a dog, everything. But on the inside, I was a mess. And I decided that the only person that's going to actually save my life was me. I had to figure this out. I had to figure it out because nobody was able to do it for me. And so I started thinking outside the box. And I said, all right, What else is out there? I'm already working out like a fiend. I'm a gym rat. That's not doing it. So what should I do? And I kept hearing more and more about things like yoga and meditation. And I thought they were ridiculous. I used to watch those people over there doing whatever they're doing in that room over there. And I'm not doing that. It's crazy.
Say, get back to my treadmill. Let me go ahead and bust out this next set on the weights and get that going. I don't have time for that.
No, that's for those people twisting their bodies in weird shapes and turning upside down and listening to weird music. And no way, I'm not doing it. But I started to hear more and more about it. And I said, one year there was this Yoga 101 class that was about 5 minutes from my home. And my next door neighbor's a nurse. And it was New Year's. And we're looking to make some changes. And I said, hey, can you go check out this class with me? And she's like, yeah, I don't know. I said, come on, let's do it. And I said, look, we'll get out of the house. And if it's terrible, we'll just go out to dinner or something, right? We'll still have fun. So I signed up for this 5-week beginner series. It was a very informal thing, like we're having now, this conversation. It wasn't really, really serious. It was a lot of question and answer availability. And after the first session, I just felt this whole 180 degree flip where I felt calm. I felt focused. I was in control. I was like looking around, like, am I in a dream or am I actually physically awake in this space? This happened to me. And so my doctor brain, my left brain's going, okay, what's the physiology behind all this? What is going on here, people?
Somebody tell me something.
Yeah. No hocus pocus. So I started diving into the medical literature and I started to see lots and lots of medical research that I didn't ever know existed about these types of things, such as yoga and meditation, and all the physiology behind these tools and why they work and how they actually work. And so my left brain was satisfied because it wasn't hocus pocus. And I just continued on in my own practice, going more and more, getting more and more into classes and meditation and feeling relief from every single one of those things that I told you that I was experiencing, from the migraines down to the paresthesias, down to the negative thoughts. Everything went away, everything. And everyone started to notice, my family, my friends, my staff, my colleagues, that I had made this shift. And everyone was asking me, like, what's going on with you? I wonder what you're having. So that was my entrance into understanding that there's more to medicine than what we learn in medical school as to how we take care of ourselves. And being the left brainer that I was, I had to just start diving in and getting certified in all the things that were helping me. So that was my entrance into, now how can I take what I've learned to help other people?
Credentials verified.
That's incredible, because one of the things that often happens to us along our pathways, learning as doctors and trying to figure out the world and how we apply the science we learn to treating people and getting them better, there's a lot of stuff we don't learn about. And so depending on the school, depending on the focus, depending on the tradition of the medicine, you just may not have exposure to some of these other things. And these are low-tech solutions that changed your life, and you saw the transformation right in front of you. So I always tell people that there are lots of other ways to go about there, even if you're having all of these physical symptoms, even if you're having pain, even if you're taking medications, there may be some other things going on. And you found that for yourself. And not only did you find it, Dr. Robyn, you said, I'm going to become an expert and help use this to teach others. That's amazing.
It's like the best kept secret. And I have to just shout it from the rooftops. And basically the most important diagnosis I've ever made for myself was that this was chronic stress. That's all it was. All those crazy things I just shared with you, the stress response in my body was making me feel these things, making me think these things. And once I learned how to work with all of that through physiology, with yoga therapy, meditation, and then life coaching through mindset work, that wonderful duo really was the answer to, to the chronic stress
Wow.
diagnosis. Yeah.
And we have too much stress in our lives. The stress has been compounded by living within a pandemic.
Mm-hmm.
So a lot of the things that we used to find comfort in or tried to do would maybe not be available anymore. We'd have to modify it, or then maybe it's available again, but then the next wave comes and then it's not. So it's nothing but transition after transition after transition. And that chronic stress, we all know the studies on it, and we know that, if it starts back in childhood, for that matter. You start looking at the adverse childhood experience study.
Yeah.
And you look at these guys and how they have had lifelong and life-shortening events that happen in childhood. I mean, their stress is no joke. So the more you know about your own stress, the more you know about your trauma that may be within your life or those that you love, the better off you're going to be. And that's when you can become a stress-free MD like you, Dr. Robyn. Now, this is a great story, and you've been able to get these additional certifications and expertise. And life seems all rosy for you now, but have you ever been dissed before?
Oh, no, not another test.
Oh, yeah. I would say, Dr. Jarrett, that my diss, which I share with our collective of physicians, is that we were never taught self-care tools beginning back in day one of medical school so that we could take care of ourselves the best way that we could so that we prevent all of these situations from happening, or at least crank them down a bit. This is a huge piece of missing education in our education system.
Self-care probably should be one of the first modules that should be taught, because there's so many things that go in there, and people talk about the stigma of even trying to access care and what that may mean to you professionally and all of these things that are out there. If we have tools that we can use, that we are taught to use, we can start helping ourselves while we're helping others. Now, I'd love to know some of the things that you think that we should know early on, and things that maybe have helped you, and maybe things that you do to help others that we could implement. Could you give us a tip, like right here and now, like something that we can use today to get our life started, Dr. Robyn?
Yeah, well, absolutely. First, just talk a little bit about some generality of the things that you can do, and then maybe I could take you through one of them. In addition to your amazing affirmations, because what you think you become, so your affirmations are incredibly powerful. And that's something that everyone should know about. And if they don't, check out Dr. Jarrett's affirmations.
Okay, if you guys haven't heard me say it before, License to Live, Daily Affirmations to Rebuild Your Life, available now.
All right.
Thanks, Dr. Robyn.
Sure. I'm a true believer. But on a more serious note, it's just we are all innately able to control our physiology. And there are two major parts of our nervous system, right? For everyone listening, docs and non-docs, we have our autonomic nervous system, which is our sympathetic and parasympathetic, or stress response and relaxation response. And we want these parts of our nervous system to be friends, to work together. Just like we have the gas pedal and the brake pedal in the car, right? You want them both to work. But what happens when we're chronically stressed is that our gas pedal is on, right? And it's just no good, because it does a lot of really bad things in our body. So I'm sharing with you the why first, because I think it's really important to understand what's happening. So when we have stress, our muscles tense up, getting ready for that event that we need to take care of. Our heart rate and blood pressure go up. Sugars and fats are mobilized for immediate energy. We have different systems shut down because we don't need them in an emergency, like digestion, like the immune system. And all of this is really, really important when we have a true emergency. But the problem lies when we don't have a true emergency, when our mind is telling us things, our brains are just making up words, but our body and our mind don't know the difference. So those same things happen. When your brain's telling you something, your muscles tense up, your heart rate and blood pressure go up, your sugars and fats are mobilized for energy, your digestion shuts down, your immune system tanks, and it makes you really sick. And it makes you really prone to some of the most common diseases in our country, like hypertension or high blood pressure, diabetes, stroke, heart disease, cancer progression and growth. And it even shortens your longevity by working at the genetic level in your body, which means you don't live as long, all from stress. I want to share all that with you so that you're like, hey, I want to take care of that.
Yeah, don't be walking around carrying this on. This is not what you want to do.
No. But whether I'm working with physicians or other healthcare professionals, whether it's cancer thrivers or our military or our first responders or the soccer moms or the corporate, whoever it is, it's important to understand the why, because then you're more apt to take care of yourself because you're thinking, wow, I can really reverse all of that or prevent all of that. So now back to your question, what can we do? So besides affirmations and working with mindset, which I know you work a lot with, it's working with our physiology. And we can do that because we can go back to learning how to put that brake pedal on, working on how to initiate that relaxation response. And so we're taught a ton of anatomy and physiology in medical school, but we're not taught that we can actually control some of it, a lot of it. So one way to do that is to work with your breath. And the breath is super cool. Like no one tells you your breath can do 4 things. It calms you down, it energizes you, it heats you up, and it cools you off. Your breath does 4 things. Did anybody know that? I never knew that. So for the purpose of stress, we work mostly with the calming and cooling, right? And the reason that works from a physiology standpoint, if you like to geek out in physiology, is because the exhale, the part of your breath when you breathe out, controls decreasing your heart rate. So when someone says to you, hey, just take a deep breath, Dr. Jared, just take a deep breath. Well, what's going to happen? All this air is like stuck up in your chest, and that's where we breathe in a stressful way. So we want to lengthen our exhale as long as possible because that brings our heart rate down, that brings our blood pressure down, and that makes us feel calmer. And we also want to breathe low into our belly because there's a very important nerve called the vagus nerve that's down low in our belly, starts in our head and travels all the way down into our bellies. And when we do that, we breathe lower into our bodies. We initiate that vagal tone, that vagus nerve, which puts that brake on. So 2 ways with your breath to calm yourself down is to lengthen your exhale and to breathe more deeply into your body. Yes, exactly.
Just like that, I'm already feeling relaxed. I've been listening to your voice. I've been taking deep breaths. I've been exhaling slowly. And just like that, I feel my heart rate lowering. My day suddenly seems better. And I know that what you're telling me is that all of these physiologic responses around breathing truly do help you feel better.
Yeah, it's a great question. I don't know if it's ever been a Jeopardy question, but if anyone says to you, what is the only autonomic nervous system piece? What is the one thing in your autonomic nervous system that you can take over voluntarily? The answer is your breath.
Very good. I can't wait for that to be the final Jeopardy question. And I have about $58,000 on the line. That is great. That is great. So, so that is one exercise that we can use right away, right in the heat of battle. So when you get that email that just tips you over the edge, when that coworker just isn't playing fair, when the administration is just forcing you to do something else that either you weren't trained to do or you simply aren't supposed to be doing, breathing could be one of those things that you could implement right away and you could have a better outcome. Personally, I like to just do some I don't know, I just call it programmatic breathing, where I'm being mindful of my breathing, and I'm simply just focusing only on that, and try to tune out all the other distractions and just get myself into a space where I'm just getting grounded. I'm getting more into my routine, and I'm starting to tune in my other senses as I'm starting to come back from that. So I love that as a skill and a technique and something simple that everybody can do right there. So thank you for that. And this is probably why you are the stress-free MD. I mean, you have these things. So speaking of the stress-free MD, you have a podcast now. You have your own podcast. And I want to know a little bit more about that. And if you guys haven't subscribed yet, check it out on the same podcast player you're using right now, and go to StressFreeMD podcast and check it out. Now tell us a little more about your podcast.
Yeah, absolutely. So many people, I've been in this stress-free space for about a decade now, really trying to share what I've learned with as many people as possible. And I frequently hear, everyone needs to know what you know. Again, not to keep it a best kept secret, right? And so I thought, well, what's the best way for me to do that? I've been working with a coach for a while, and she's been telling me I need to do a podcast. And finally I said, okay. So I did. So I decided, all right, well, what's the best way for me to also deliver this information? And I know that people are really busy, whether healthcare professionals or not. So I decided to create stress-free snacks, snacks of information that are in 15-minute-ish segments, so that you can get from point A, point B, if you're in your car, if you're going from one place to the next, if you're doing something quickly, if you're walking outside or waiting for your kid at some place, you're in the grocery line or wherever, that you can actually accomplish something, that you can learn something quickly and easily to implement and to teach other people. And it's mostly me. And then once a month, I have an expert guest. So far, they've been physicians that come on and talk about their relationship with stress in whatever area they are in. And it's been going well so far. I've been getting lots of amazing feedback of, how individuals have already been implementing, for example, this breathing tool. I have one episode called Hail to Your Exhales. You can go on there and actually learn how to do this tool. I've used it on an airplane. The plane did not have to land. I've used it on a train. The train did not have to stop because other passengers were having panic attacks that I taught them to. I use it at the scene of a car accident for both the individual who was hit by the car and the individual who was driving the car. And now I have listeners reaching out to me saying, I just use it here, there, and everywhere. So it's really, really amazing. So I would love for you to check it out, learn how to become stress-free from the inside out, all by yourself.
And we will have the episode link to Hail to Your Exhale right in the show notes. So you don't have to go anywhere. You can just click right in there, get right into this skill set, and find some more things that are going to help you in your daily life. As you guys know, one of the things that I love to tell people, I love to talk about, is taking care of yourself. Self-care. We always start License to Live, the conference, with a self-care segment, because what do? We care for so many others. We forget to care for ourselves. And this is where a lot of these sources of overwhelming stress, burnout, all of these things that we talked about occur. And you guys know a few episodes ago, I told you that nobody cares about your burnout. Nobody cares about your burnout. Now, maybe I do. I know Dr. Robyn does, but the people who should be concerned with your burnout usually are not. And you have to find tools to reduce your stress every day. And Dr. Robyn has a few of those. Dr. Robyn, what would you say to someone who knows that they have had it in their career? They're kind of at that place where they just don't know what to do because they're not finding the joy. It becomes more of a stress. And you went through a series of changes in your own life and transformed your own career. What would you say to somebody out there who may be contemplating going in a different direction?
Well, first, I'd like to say that make sure that you're not running away from what's going on, but you're moving toward something else. Because I've worked with a lot of clients who came to me and they were really running away. And once they learned to find joy and fulfillment in their own life, they actually stayed in their current position because they learned how to be calm in the chaos of what was going on. So just because you're unhappy doesn't mean that you're actually unhappy in what you're actually doing. It's just the circumstances that you need to learn to deal with. So I'd be very careful first that you're not running away from something, but to take care of yourself first. If you still feel after you've learned self-care that it's not really for you, then it's okay. It's okay to move towards something else or just to add something else into your life as an appetizer, as a taste, to see if that's something that you really want to do. Because you don't want to be sorry moving on to the next thing when you still haven't dealt with the actual cause of what's happening, which is your own stress and anxiety and unhappiness.
Licensed to live.
Awesome. And that's great advice. I love it. Dr. Robyn, where can people find more out about you?
I'm everywhere. Come find me. I want to help you. You can find me on my website at StressFreeMD.net, where you can sign up for the free self-care videos, one of which is the breathing tool I was talking about. There's a link to my podcast on there. You can sign up for a free 30-minute stress relief strategy call. I also have several CME accredited programs. So if you're a healthcare professional, a doctor, a nurse practitioner, a nurse or a PA, you can actually get credit and have it paid for to learn how to take care of you. And several of those programs are for the general public. So they're open to everyone. If you want to learn to meditate, sleep better, learn how to breathe, learn how to move your body so you can relieve all that chronic tension. If you want a combination, there's a sampler as well. So I encourage you to check all of that out. And if you're on social media, you can find me on Instagram at StressFreeMD. You can find me on LinkedIn at Robyn Tiger MD, Facebook, StressFreeMD at Robyn Tiger MD. And yeah, those are the places I hang out. So give me a shout out.
We love to hang out on social media, and Dr. Robyn and I met through social media at one of our favorite places. You guys know I love to hang out in LinkedIn between the episodes. And so I'm just seeing what's going on. And that's where we really got to meet and talk. So I encourage you to find Dr. Robyn, find myself, find us on LinkedIn and social media, because this is a way for you to engage and interact with us. And who knows, may become great friends. I mean, I know that Dr. Robyn and I, next time she comes to Philly, we're going to be connecting over here and we'll maybe reminisce over a cheesesteak or something.
Well, Dr. Robyn is vegan, so.
and I was going to say a tofu cheesesteak.
Okay, that's good. Perfect.
So, Dr. Robyn, I certainly appreciate you spending some time being here and giving us some great tips for the audience today. Is there anything else you'd like to say?
I would just like to let people know they're not alone. For so many years, I felt alone, and I didn't know that what I was feeling was really common amongst other people. So reach out, ask for help. Me, Dr. Jarrett, someone else. Just know that you're not alone and that you have the innate ability to make yourself feel better and to live the life that you deserve.
And you deserve to have a great life. It certainly can be enhanced from some self-care. And who doesn't like self-care snacks? So we'll make sure that we're following your podcast as the Stress-Free MD, Dr. Robyn. Thank you for spending some time with us today and coming on the show.
Thank you so much for having me. It's so wonderful to be here, and I'm really honored. Thank you.
Remember, fire starters, if you or anyone you know has been disengaged, dissatisfied, disgruntled, disenfranchised, please invite them to join us along this journey. Simply go to your favorite podcast player and subscribe to License to Live. And while you're there, please rate this episode and give me honest feedback so I make sure I provide you with the most up-to-date information about career challenges and life changes. And in the meantime, make sure that you are breathing, that you are practicing some self-care. And if you feel like you're too stressed out, now is the time to do something about it, because you should not be carrying all this weight, just as Dr. Robyn said in this episode. So if nothing else, simply reach out for help. And until we see you guys again, see you next time.
No matter how disheartening the moment of accusation sounds, how deep the pain of immobilization stabs, or how bleak your future looks, no one can take away your license to live. Keep Dr. Jarrett's expertise handy and unlock your future. Go to Apple Podcasts, Google Podcasts, or another podcast player and subscribe right now to Licensed to Live. See you next time.